hello there. Please take a seat. I'm Dr. Sarah. Nice to meet you. Okay. I'm just having a look through the notes that the nurse has just passed over to me. Could you just confirm your name for me? Okay, that's fine. And your date of birth. Good. And your current address. Alright. So let's see what's going on with you today. Alright. So you're experiencing some ear pain and jaw pain, okay, and your ear feels sore. Okay, have you got some hearing loss? Alright. Is your ear painful to touch? Okay. Okay. Have you had a recent infection, like a cold? No? Okay. Do you have a sore throat at all? Okay, but the pain's in your face? Okay. Is that both sides? A little? Alright. Oh dear, so you're probably going to be feeling rather miserable, aren't you? Okay. Right, let's just have a look here. Okay. Have you been taking anything for the pain? Just paracetamol. Okay. And have you noticed any discharge coming from your ears at all? So the one side feels a little bit wet. Okay. Alright. Before I go on and examine you, do you do swimming at all? Do you do swimming activities? Okay, you do. Okay. And you do some wild swimming too? Okay. Alright. Okay. I can't see you've got a history of ear problems on those notes, but have you had any problems before? Okay. Alright. Okay, well you just relax there and I'll get ready and I'll give you a little check over. Alright. Okay. Now I know you're very sore, so I'm going to be as gentle as I possibly can. Alright. And you must tell me if anything feels too painful or too uncomfortable. Okay. I think lots of people have been going out swimming in rivers and things with the nice weather, so you're not alone. Okay. Firstly, I'd just like to take your temperature, if that's okay. Alright. This will just beep. Okay, and I'll just be pointing it at your forehead. Alright, okay. Just keep nice and still for me. Okay. That's okay. The temperature's good at the moment, which is nice to know. Alright. Okay. Now I just want to have a little feel gently around the ear, okay? Just tell me if anything's really uncomfortable. Alright, I'll start with your right ear. Okay, keep nice and still for me. Okay. Okay there. So I'm just going to have a little press around. Little press. Press. Does that hurt? A little bit sore. Okay. Okay, I'm just going to pull pull gently. Oh, okay, that really hurts. Okay. Okay, does it hurt if I just press there at the top of the ear? Okay. Around the bottom. Okay. Alright, that's great. Let me just take a look at your left ear. Okay. Alright. So, having a little press. Just a little press around. Does that hurt when I press there? Yeah, okay, I'm sorry. Pull that up. It hurts a little when I pull it. Yeah, okay. Just another little press around. Very, very gently there. Okay, that's great. I'm sorry that was a little uncomfortable. Can you just open and close your jaw for me when I put my fingers on the side of your face? Very gently. This might be uncomfortable for you, I'm sure, so just tell me if it's really sore. Okay, and slowly open. Alright, that's sore, okay. Can close. And again. Alright, okay. Alright. Do you mind if I come a little bit closer and just check your lymph nodes? Alright, okay, just going to come a little bit closer. Just gently press down on your neck. Alright, a little bit of a swollen lymph node on each side there. On your preauricular lymph nodes. Okay, let's just check and just behind your head. Just the occipital ones there. Okay. Alright. Okay. Now, I know you can't open your mouth too wide, but I would like to just have a little look into your throat if I may. Okay. Don't worry, I'm not going to push too hard or too deep with this. It's just so I can have a little look around, just to make sure there's nothing else going on. Okay. I'm just going to shine this light into your mouth. Alright. Just open as wide as you can for me. Okay. Thank you. Just pop that in there. And just have a look. Okay. Can you say "ah" for me? Alright. Okay. I'll just give you a little break. Alright. And again for me. Okay. Just taking a little look there. Alright. That looks good. Okay. Fine. And while I've got the light, I'm just going to check your eyes. Okay, make sure there's no signs of any redness or inflammation there. Okay. Can you look just straight at my nose for me? I'll just check your pupils. Just check that pupillary reaction there and in your left eye. Okay. I'm just going to have a look around the eye. You can close your eyes for this if you like. Just using my light. Okay. Just looking at the skin. Okay. And here too. just around the eye there closely. I can't see anything unusual. Just going to pull your lower lid down. Okay, there. Can you look up for me? Okay. And just going to pull the lids up. Okay. Can you look up and down? Okay. Alright. You can relax now. I just wanted to check that you've got no infection going on anywhere else, but everything else seems fine, so I think we are going to be looking around the ear area that's the problem. Okay, alright, so what I'm thinking you may have is a condition called Otitis Externa, which is commonly called swimmer's ear. Okay, which would be very fitting for what you enjoy to do. And it's mainly caused by getting a lot of water in the ears. It can cause a bacteria to form. Okay, and this can cause the ear canal skin to be very inflamed, to swell, to weep. It gets very, very sore, and the pain can travel into the jaw just like it's doing with you. Okay, I'm thinking that's what is going on, but I will need to have a little look inside your ears, okay, to double check that, but I'll be so gentle because I know how sore it is. Okay, but before I do that, I'm just going to have a little gentle wipe with these very, very soothing wipes, okay. They're nice and cool. Alright, just on the externally and just a little bit inside before I have a look. Okay, keep nice and still for me. Alright. There we go. Little wipe. Very gentle wipe there for you. Okay. And on this side. Little gentle wipe. Is that okay for you? Good. Okay. So I'm going to next be inserting an otoscope into your ear. Okay, I'll just give those a second for the ears to dry off. Okay, give them a little waft. Okay, that's fine. Yeah, just give them a little waft. That's good. Okay, I'll be back in a second and I will do an examination. All right. Okay there. Good. You give them a nice little waft now. Good. Okay. So for the otoscope examination, I'm sure you've had one of these in your ear before. Just a little light with a tip and just gently pop it into your ear. I will just move your ear canal slightly by pulling up on your ear, but I know it's going to be painful, so I'll be very quick and very gentle. I'll just have a look to see what I can actually make out without causing you any pain. Alright, so just keep nice and still for me. Okay. Alright, so I'm just going to pull up and back on the ear and just gently insert the otoscope. There we go. I'm sorry if that's sore. Let me just take a little look. Oh yes, I can see it's very, very inflamed in there. Very, very inflamed. Just move it just slightly. Oh gosh, your eardrum is not visible and the ear canal walls are virtually touching there. Very, very swollen. And there is a little bit of a discharge coming from that. Okay. Right, I'm not going to cause you any more discomfort there. I'm just going to withdraw the otoscope now. gentle, I promise. Okay. Alright, okay. So just pull the ear slightly and pop in the otoscope. Okay, just have a little look around. Okay, again, this is very red and inflamed. It's not as bad as your right ear, but it's really looking irritated. I'm sorry this is sore. I'm so sorry. I don't want to hurt you. Okay, just look there. Can barely see your eardrum. Alright, let me just gently remove this now. Okay. Well done. I know it's very uncomfortable. Let me just jot a few things down there on my findings. Are you doing all right? Okay. Well, you definitely have swimmer's ear. Okay, Otitis Externa, and it can easily be treated, alright, with a spray that I'm going to give you, and I'm going to get some of that now, and I will administer the first dose now. Okay, it contains an antibacterial and an antifungal agent, okay, because these are the things that are very most present in swimmer's ear, alright, and it should start to resolve within a couple of days. Okay, it'll feel a little bit sore and a little bit tingly sometimes at first when you put the spray in, okay, but then it'll work its magic. Alright, okay, so I'll just get some of that for you. Okay, just check what I've got over there. Obviously this is a new box especially for you. And it's an extremely effective treatment. Okay, let's get that little shake. I'm just going to check the nozzle there and do a little test. Yep, that's good. So, how you administer this nozzle here, you gently put it into your ear, pull the ear up a little bit, just pop it inside the ear, you don't have to push it, it won't go in too far anyway, and then just give a press down and it will spray the medicine into your ear, okay, and I'd like you to do that twice a day, okay, for up to a week. Okay, if it's not resolved by then, you must come back, but I'm pretty sure you're going to be feeling so much better in a couple of days or so. Alright, so let's just get some nice gauze there, because I don't want it to run out all down you. Alright, keep very still for me, and I'll just do a little spray in this ear first, okay? Alright then. Okay, just going to pop that just on your ear there. That's good. Is that okay and comfy? Super. Okay. There we go. That's that one done. There we go. How does that feel? A little bit sore. Right. It'll wear off shortly. It's because your ear canal is so inflamed, and this does sting a little when it goes in while it's so inflamed, but it's so effective, so that discomfort won't last too long. Alright. Okay, let's have a look at this side for you then. Okay. Let's pop that in there. Just inside the ear canal. And a little shake and a spray. There we go. All done. Just give that a nice wipe. So I'm going to pop this back in the box for you, okay? And you can take this with you. There's a label on the box, so I'm just going to write the dosage. Although it says it, I'll write it and sign it, okay, on the box. That's just one spray twice a day. Okay. Alright, and I'll just put my signature on there and the date. It'll say if you go into the pharmacy. Okay, so that's for you. There you go, super. So I'm just going to get a little cotton wool. But now you know you never stick these down your ears, okay? Because that causes lots of problems with impacted wax and can also irritate the eardrum. I'm just going to just gently pop just inside and just wipe off any excess, okay, of the drop. Alright, okay. There we go. Let's just... Is that okay for you? There we go. And on your left ear. That's great. So that's all done. And what I'm going to do quickly is I'm just going to have a little look at the otoscope now. Just a very quick look, okay. Just to make sure, just popping that in there very gently on the outside. Yep, okay. Make sure everything has been coated with the spray. That looks fantastic. Alright. Okay. You're doing really well. Nearly done now. Okay, just remove that. Okay. A little look in your eye, dear. Okay. Alright. Just a little look. That looks fine too. Does that feel okay? Alright. Okay, I'll just remove that now. Perfect. Well, I'm very happy to say that you're going to be feeling better in a few days. And on the off chance that you're not, then please do call us. But you'll find the spray very easy to pop inside your ears. Yeah? Okay. So if you just check out with a receptionist on the way out, they will just administer the charge for the spray. Okay? In the same way that you would if you go to the pharmacy. Okay, if you just show them the box, and I'll let them know that you're going to be there in a minute. Okay, so you go home and rest. Take paracetamol for the pain, that's absolutely fine, as you're doing. Okay, have you got any plans for the rest of the day? No. Well, you go home and rest. Okay, and then pop some more spray in this evening. It's best to do it morning and night. Okay, well I hope you're feeling better very soon. Okay, take care. Bye bye.